All right, so our next speaker is going to be Matt Adams, who's going to be speaking on comparison of Google AI overview tool responses with the 2022 updated clinical practice guidelines on tympanostomy tubes in children.
Okay, good morning, everybody. So once again, I'm Matthew Adams. I am presenting on a study entitled Comparison of Google's AI Overview Tool Responses with the 2022 Updated Clinical Practice Guidelines on Tympanostomy Tubes in Children. I worked on the study with Dr. Plum as the mentor. Thank you to her and also to our wonderful medical student, Melody, as well. So to get started, as we all have experienced, artificial intelligence is becoming more and more integrated into our lives. It seems like more and more with each passing day, including medicine. How many in the audience use Google? Everybody raise their hand. Yeah, right? Everybody uses it. So I'm sure you've noticed that since about last year, around this time in May of 2024, Google introduced this AI overview tool that appears at the top of the search bar when you put any query into Google. It's a generative AI tool. Like many other AI tools, such as ChatGPT, it's frequently used, and these companies that have developed these really caution that medical information that is generated by the tool should not really be taken by a grain of salt. You should follow up with the provider for further questions and consult with them for further information. Kind of contrasting with that, the clinical practice guideline statements, which are many, and so we specifically looked at the tympanostomy tubes statements. They provide information for providers as well as patients and caregivers to help guide both providers and patients and counsel them on the appropriate treatment management, workup, and so on and so forth. So our goal was to examine how this AI tool's ability to answer common questions that were related to tympanostomy tubes and how these answers generated by the AI tool compared with the clinical practice guideline statements. So our aims and educational objectives here were to first understand Google AI's generative tool as a potential source of information for patients, to then appreciate the accuracy of the AI tool in summarizing information on tympanostomy tubes, and then to stimulate further ideas how to help either the tool get over inaccuracies and to help safely integrate its use into clinical practice. So the methods here, this is a cross-sectional study. So we came up with 25 questions that pertain to acute otitis media with effusion, tympanostomy tubes in children. And then these questions were searched in Google as a question, formulated as a question. 15 out of the 25 were tied directly to a clinical practice guideline statement. And these responses, in addition to just the responses that we got from Google, we also recorded the cited sources. And these informations were then collected, scored for accuracy against the clinical practice guidelines themselves. The responses were also then scored by 2 different pediatric otolaryngologists. So how did we see how these lined up with the clinical practice guideline statements? So we scored them on kind of 3 different tiers as being aligned, partially aligned, or unaligned. If there were no missing components and no inaccuracies when compared to the clinical practice guidelines, then it was considered to be aligned. If there were 1 to 2 missing components, or 1 or 2 inaccuracies, then they would be partially aligned, and if there was 3 or more missing components or 3 or more inaccuracies, then it would be unaligned. And then we also used a Likert scale and presented these responses to the 2 pediatric otolaryngologists, again asking them how they agreed with these statements. Okay, so our results. So 26.7%, or 4 out of the 15 that were tied to clinical practice guideline statements, were scored as aligned with those statements, and 66.7, or 2/3, were scored as partially aligned, with only 1 being scored as unaligned. 28% cited primary literature to support the summary, whereas only 8%, or 2 out of the total 25 total, cited the updated clinical practice guidelines. 96%, interestingly, cited secondary source websites, such as those provided from hospitals or health systems as a kind of summary statement about information. And so I'll give an example here. And so, this is one of the questions that we had. So when should my child get tympanostomy tubes? And you can see that the AI overview tool generated a summary, and then you can see over on the right side the the citations. And the first two that pop up are from the Mayo Clinic and CHOP, which are obviously both very well-respected institutions, but are secondary sources, being a general summary on these topics. And then also looking at, so when we asked the two pediatric otolaryngologists to score the different summaries, so the median score of attending number 1 was a 4, or some would agree, and the median score was a 5, or strongly agree, for attending number 2, and there was a statistically significant difference between these using a Mann-Whitney test. So the interpretation. So many of the Google AI tool responses were partially aligned with the clinical practice guideline statements. Revealing that there are likely gaps in this tool's ability to provide accurate data for patients. Most of the AI responses were drawn from secondary sources, as I mentioned earlier. Here there is a risk of bias, misinterpretation of data, and the summarization of outdated information at these, using these sources. So some of the implications, so patients and families might encounter information that does not fully align with the clinical practice guidelines, and that might ultimately alter informed decision-making when we're counseling these patients. Some of the limitations of the study, so as a generative AI tool, it's, as you feed it questions over and over again, there might be some differences in the responses that you can generate, and so the next main step for this study is to run the same questions through Google a few more times, see if there's any differences in the responses, and report that if that's something. See if it gets, maybe it'll get better the more times you run the questions through the study. There also might be potential bias or limitations with the AI itself, like the tools that were used to train the AI tool to begin with. So conclusion, so the majority of the responses that were partially aligned with the clinical practice guideline statements. Nearly all queries yielded secondary sources for information from health centers or academic centers, and users should be cautious in seeking medical advice from a Google AI tool, and instead confer with a provider. These are my references, and any questions?
Thank you for doing this, and it confirms what we've seen for many years, just even looking at the quality of information on the internet that people can access about otitis media tubes, other conditions. So I might have missed in the beginning, did you actually train the model by uploading the
No,
CPG?
we just feed the questions directly into Google.
Okay,
Yeah.
because that could easily be done. You can upload a PDF of a document, a guideline, and you'll probably get more accurate responses than just searching the web. But what you found is not surprising, and you'd think it would be limited to what you do. Is anyone aware of all the problems with the MAHA Commission report on children's health that just came out? Government released, I think, a 69-page report on children's health, Make America Healthy Again, came out about a week and a half ago. And I was delighted to see, under the overutilization category, the lead statement was that, quote, despite national bodies recommending ear tubes for recurrent infections in children, there is no benefit and only harm. They also said that tonsillectomy doesn't work for OSA, by the way. So you might as expect our academy mounted a response, which I thought could have been better. And actually, I managed to get, first time ever, a letter to the editor published in Wall Street Journal about 2-3 days ago. So if you look up Rosenfeld and RFK or MAHA, you'll see this letter very easily. And it reaches about 5 million people, which is good. And, I basically said, as the author of the report cited to support this erroneous statement, is completely fictitious, and, corrected it, that tubes are effective when there is persistent fluid, or if there are recurrent infections that persist despite watchful waiting. But also in that report were fictitious citations, AI-generated hallucinations, et cetera. Did you find any hallucinations here in the sources cited?
No, the very few primary sources that were cited, they were actual, I was able to, they had a PubMed index there, and I was able to search them and find them.
No,
So
just
they were not
having a
hallucinating.
PMID or a DOI, they could still be fictitious. I've seen that
but
many
I
times.
put it into PubMed itself
with AI.
and found them. So,
And,
yeah.
and how does Google AI compare to more common ones like Claude or ChatGPT?
It's more, I think you don't train the system as much, so I know for ChatGPT you can ask questions and provide it with a document and summaries and things like that, but Google AI is really just I don't know of any way to train it exactly. It's, yeah. It just pops up automatically, yeah, yeah.
For the partially aligned or misaligned, were there certain groups of questions that occurred, or like whether it was indications or complications or
We didn't group them. That's a good question. I don't know if there's a specific.
if there's more
if there was-
controversy about?
Yeah, we can certainly group them. We didn't look at that itself. Yeah, absolutely. Yeah. Yes.
So you had a single reference to compare to a gold standard, right? A practice recommendation. But it gets to a bigger question: what is the real truth, right? So if you were a similar study, and instead of comparing to practice recommendation, if you asked 10 different pulmonologists and 10 different ENT surgeons how to treat sleep apnea, would you get consistent answers?
Probably not. Yeah. We did have two pediatric otolaryngologists who were able to score them, and there was a little bit difference, but between the two. Dr. Weiss.
Yeah, but overall, like between the two pediatric otolaryngologists who reviewed this, we were pretty much either somewhat agree or agree with the majority of the statement. So it does have potential.
My comment is that in all my years in practice, when patients do research on the internet, 9 times out of 10, they succeed in scaring the daylights out of themselves, and maybe 1 time out of 10, it's useful. But having said that, this is a moving target. And I think that AI is getting better and more powerful all the time. And a couple of years ago, the early iterations of ChatGPT sounded like gibberish. And now, sometimes, advanced AI can compose a coherent paragraph that sounds like it's written by a person. So I think that if we completely dismiss the internet and AI and say that it's gobbledygook and it can't hold a candle to our own brains, we might miss the boat. So it is a moving target, and we need to keep tabs on how these things develop over time, because they may be useful tools for us.
Yeah, I want to relate to what was just said. You're talking about in general tools for AI. There are dedicated medical tools for AI. For example, Dr. Oracle, Open Evidence. Open Evidence just signed to take the entire library of the New England Journal of Medicine and Walcott published papers, and to run specific on the data. You need to understand that AI runs on the data source. So if the data source is the entire internet, obviously it will make mistakes. But if you limit it to data that is relevant and you can quote it, then that makes it an accurate tool. I think I relate to what was just said. I think if we avoid that and neglect that, then we're going to be off the train. We should think of how to use those instruments because they are the future.